Hello everybody, this is Dr. S and welcome to Dr. S Show. Before I start today's subject, I would like to ask you guys pay attention to a few things I'm going to tell you and ask you. Please subscribe and ring the bell and give the thumbs up, and also visit Dr.Sokhandan.com website. My website, it is made for you guys. If you have any question, the question which is about your health, about some of your blood work, write a note in my website. It can be an email, send it to me. When I receive that email from you guys and your question, I will make sure talk about that issue the next show, which is I'm doing on YouTube. Sometimes some of the question you have and you need to know and you don't have no answer for it, but I can look at those questions and answer to see what the issue is, and those issue maybe be a problem in a near future or maybe not, but it's still gonna give you some of the answer to your question. I'm gonna have a daily show and hopefully you guys follow and be with me through this process. Today I'm gonna talk about the 13 disease which is cause arterial disease. It's been cause our artery get damaged, because of course you guys know our artery is a main highway to take the blood to every cell of our body. Through that blood you got all the nutrient, you got all the level of a hormone which is our body need to use for healing, activation, immune system, and on and on. But at the same time there are other component of our body which is the veneal part of it. It takes the blood away from the cell and from the body, return to liver, do the detoxification, clean it, send it back to the heart, get the oxygenation, then mix it with the other nutrient, send back, and this cycle repeat itself day on day for 365 days. Even you're asleep, this process never stops. For that reason, it's very important for us to pay attention what our health means to us. I know so many of you taking a medication, and I hope not, but average American take between 3 to 5 medication a day. Our body do not need medication. Medication, it is a necessarily when it's prescribed properly. When you take a medication is not prescribed properly, can cause lots of other damage. We have to pay attention to what our body tell us, because sometimes your body will tell you what's going on, but unfortunately we ignore and we do not pay attention to that. Then we find out the disease already start and the process is being passed the stage of a acute to the chronic, and it's hard to sometimes reverse it. But whenever we talk about arterial disease, we have to pay attention to many steps, and I hope you guys pay attention and write. If you want to take a note, that'd be great. If not, but remember those components which is I'm trying to bring to your attention. You can talk to your doctor, and of course with the TV and YouTube you cannot do healthcare. They only give a highway between the doctor and the patient. But since e-health and digital health become part of our new part of society, for that reason people can seek a help from any physician throughout the world. Can be Australia, can be US, can be in Bangladesh. If it's a good doctor and you want to reach and seek their help, now this availability is for you guys. The first component, which will cause a damage to arterial, it is hypertension. It's a high blood pressure. When the blood pressure increases, your arterial have to expand to accommodate that amount of the pressure of the blood through the system. And of course, whenever that blood pressure increase, the arterial will expand, the pressure will gonna build to many other organs, like a kidney. A kidney has many hormones, just like a renin. Then renin has to get activated from there, go to the lung, then angiotensinogen 1. The name is not important. The only thing is the ripple effect of the process of that chemical reaction I'm trying to bring to your attention. Then if the blood pressure builds so much, eventually will cause a stress to kidney. Then whenever you guys don't want to do the blood work, make sure pay attention to the kidney function, which can be a component of creatinine and blood urine nitrogen. Those is going to tell us, what the kidney function is the filtration is worked properly. Sometimes you can even do the urine analysis. Through that urine analysis, we can see what ingredient of the chemical is passing through our kidney, through our urine. Then from there we can check if in case you're passing protein, or if it's the excess of a nitrate or the leukocyte, which is a white blood cell is there. Then we go ahead and pay attention to those things. But building a high blood pressure, not even stress your arterial, but stress the kidney. Then from there, going to be pulmonary, which is your lung, and the other component can be liver, because liver is a part of that system. It takes the blood for the filtration. That is very, very important. We have to pay attention to it. The next one, which is majority of you guys probably do not know, maybe your doctor never checked for that blood test, is a CRP. CRP stands for C-reactive protein. That C-reactive protein, when it get into your bloodstream, it means your body is in an acute stage of some sort of an injury or inflammatory. It can be a viral. Those need to be paid attention. Unfortunately, majority of the time, since your doctor is under lots of stress and scrutiny of the insurance company, they do the minimum blood work, and that minimum blood work is just basic blood work. You do not need. Sometimes you need to spend the extra money if you have to do the complete blood work. If you guys follow my program, eventually I'm going to go to all the blood work, talk about what blood work you need to do, what is essential, which one is a non-essential, what age is to do what blood work, and what age other blood work, to make sure you stay on your top of your health. Yes, our body, it is work day in, day out with all the chemical compound and reaction and the hormone on top of it. But CRP, it is another important test need to be done. I know some of the physicians do whenever you have some episode of a heart issue. You feel a chest pain, you feel a little bit of numbness in the hand, sometimes dropping your blood pressure when you stand up and you feel you're gonna faint. Those times your doctor trying to check your heart to see is any issue with your heart and the damage to the heart. CRP is not just for the heart. CRP, it tells us an acute stage of an inflammatory and viral injury, can be for any part of the body, and that is very important for us to do. The next component we have to pay attention, it is a test of the fibrinogen. When we look at the fibrinogen, it is an excess of that in our bloodstream. Usually fibrinogen used for blood clotting because it will cause a blood clotting if we do not pay attention. When the numbers go up, it will cause the viscosity go high. When the blood get thicker, then possibility for you guys to get blood clotting, move on, and sometimes heart attack or stroke. The next component we have to pay attention, amount of the blood sugar, which is you test day in, day out if you are diabetic. But the majority of people do not test their blood sugar every day. Whenever you go see your doctor, specifically for the people over age 35, 40, do your blood work in the morning, be a fasting blood sugar, and also do 2 hours after. Do the insulin resistant test, and also hemoglobin A1C, which is for diabetic, and also estimate average glucose, which is a EAG. Majority of the laboratory they do, but sometimes you have to pay from, off your pocket. That extra is going to be cost, and sometimes your insurance company do not cover. Then it's important to pay attention to the blood sugar, because blood sugar, sometimes we can be hypoglycemia at the age 18, 19, 20, but we never pay attention. Hypoglycemia, it is when your blood sugar drop and your insulin increase above normal. Sometimes blood tests cannot tell you you are hypoglycemia, but if you have a doctor, the endocrinologist, which is you go see, they can probably analyze that and tell you you're a hypoglycemia. But few simple symptom which is you experience, and you can, based on those simple symptom, you can tell you are a hypoglycemia or not. One of the symptom, it is a cold sweat, aggravation. You feel whenever the food is not getting you right away, you feel nauseation and you get stressed out, and sometimes is even get you a little bit feel you are not yourself. Those is a symptom of a hypoglycemia. It show hypoglycemia will end to be a diabetic. Then pay attention to your blood sugar. Glucose is the only carbohydrate that circulate in our bloodstream. For that reason, whenever your body, the glucose go high, because in our part of our brain, we have a layer between the brain and the blood, they call it blood-brain barrier. The glucose circulate all the time, and the brain take that sugar from the blood and function properly. Eventually, when that glucose go high and insulin become resistant, then damage can happen, because that glucose in the blood, it is a detriment to every cell of your body. Then we need to pay attention to glucose. The next one we have to pay attention, it is a low vitamin K. We have a 4 vitamin, it is oil soluble, which is go through the liver, get dissolved, get downregulated, and go to the place. Vitamin K is one of those vitamin, fat soluble vitamin, is a vitamin A, E, and also D, plus the K, the 4 vitamin. Vitamin K is important because prevent calcification in our artery. When you get calcification in your artery, which is the name is atherosclerosis, it means the hardening of your artery. The calcium come over there, then we have the body create some cell they call a foam cell. They get attached and create like a cement. And of course you have a high cholesterol, the cholesterol be a part of it, and then make your artery narrow and the blood circulation going to be less. And the first damage B for our heart. Then vitamin K is very important. It is one of the blood clotting factor in our system. We need to pay attention to that. The next one we have to pay attention is a low amount of a EPA, DHA. That's an essential fatty acid, which is you can get from your omega-3, which is your fish oil. EPA and DHA, it is very important in component anti-inflammatory our system, specifically in a prostaglandin number 2. We have a 3 prostaglandin, which is a function for system needed to make sure the inflammation to not build. Prostaglandin 2 will increase to help to inflammation go down, and that by having enough essential fatty acid, EPA and DHA. Usually when I deal with my patient, when I look at their supplement and when we do the blood work, and always I want make sure EPA be twice as DHA and essential fatty acid be above 1200. Those is you can see through many companies they selling those fish oil, but you have to find the right kind to make sure give you a better for your body. Sometimes the price is not what you were looking for. The cheapest one, it don't mean is the worst one, or the expensive one is the best one. You always have to find the right fish oil, which is going to give you that essential fatty acid, the EPA and DHA. That is very, very important for our system. Now, when we go to number 6 is a triglyceride. Triglyceride, it is a backbone of our cholesterol. Whenever you guys do the blood work, you see your doctor do the total cholesterol, do the triglyceride, they do LDL and HDL. LDL, low density lipoprotein, HDL, high low density lipoprotein, high density lipoprotein. Whenever we're looking, those number is very crucial. Always your LDL should be twice as HDL, and your triglyceride should be right around 56 to 80. Again, the information I presenting to you today, it don't mean you need to go look at it. Oh my God, is it so high? Just get the information, talk to your doctor. Information you get in here is just the extra knowledge for you guys to give you a little bit of an edge to understand about the health. The whole program in this YouTube, I'm trying to present it to you guys to make sure you be educated and be more aware of your health and understand the concept behind those blood work. It's just not because of you doing a blood work, because of doing it. That is not what you guys do in a blood work. You're doing a blood work because you want to know what it is the issue with the system. If it's something excess, something deficient, then you can go ahead and take care of that before the trouble arrives. Whenever we look at the triglyceride, the LDL, as I said, LDL should be twice as HDL. LDL, probably some of you guys know as a bad cholesterol, and HDL as a good cholesterol. We don't have such a thing as a bad cholesterol or a good cholesterol. LDL is the one carrying the cholesterol to every cell of our body. Whenever this process happens through our artery, some of the cholesterol being dropped out throughout the artery, and HDL job is to come and clean, take those excess, bring back to the liver, and the liver take that cholesterol and mix with the bile, and body excrete it through the feces. That's just the process. That's what they say, good and bad. The other component of a triglyceride, whenever we look at for your lipid profile, we have to pay attention to VLDL, which is very important. We have to look at the lipoprotein A, lipoprotein B. Those modules, those small cholesterol, which is a behind the scene, they work in our system. Probably none of your physician will pay attention to it. But as long as your cholesterol, they say, is okay, your triglyceride a little bit high, and they don't see that much issue, they did they will not be worried about it and they do not follow up with it. But it's a good idea to, a certain age, especially when you're young at age, say, 25, 30, to do a comprehensive, do a lipid profile, specifically VAP test, which is look at all those small details. Then you have some map for the future. If you go to doctor at age 50, you have that blood work, and your doctor look at that blood work, says, yes, at this age, you had this issue, and now we can see this process is progressing and we need to do something about it. Unfortunately, sometimes we don't pay attention to what our body tells us, then we end up to taking so many drugs, specifically a statin drug or some of the blood sugar drug to decrease our blood sugar from our system, like metformin, which is the one being prescribed widely. Every part of the world, they use that medication. But pay attention to what your triglyceride is, because that will cause the arterial damage, and that arterial damage, it will cause lots of other issues in the future. The next test, which is very important for you guys to ask your physician to do for you guys, it is a homosystem. Probably this is the first time you guys hearing about it. Homosystem, it is an endogenous toxin which is our body make from breaking all the amino acid of our system. Specifically, sulfide contain amino acid, which is a breakdown, and the base of a lack of a B12 and some of other component of a nutrient that homocysteine built up. And homocysteine show cause a damage to artery, cause atherosclerosis, cause blood clotting, plus lots of other disease, autoimmune disease, like MS, arthritis. Of course, we will talk about all those diseases in near future through my daily Dr. S show. And again, I can ask you guys if in case you have some question you want me talk about some of the issue you have on your mind, send me through the Dr.Sokhandan.com, my website, and I'd be happy to answer all those questions too. Then homocysteine is very important to make sure we test that, because it will tell us some disease can be on horizon. The next one we have to pay attention is the insulin. We check the insulin, specifically insulin resistant. It shows specifically by insulin become resistant, the blood sugar increase in the arterial, that cause damage, and sometimes insulin resistant affecting component of our body, cortisol, the effect, growth hormone go down, then sometimes you need a stimulant to build your energy, because system is overstressed by drinking coffee to get yourself energy to wake up in the morning and move on with your daily life. And that coffee by itself will cause more insulin resistance, then growth hormone go down, then you start gaining weight and you wonder why you're gaining weight. That is another test we need to do. The other component is a hormone. Majority of hormone is, which is our body have, and for a male or female. One of the hormone which is we have to pay attention, it is a testosterone. Testosterone in man and woman, specifically in man, it's secreted by testes and adrenal, and the female, by ovary and also adrenal. Testosterone is just not for your sexual drive. It is part of a well-being of your system. It decreases your blood pressure. It regulates your blood sugar, decrease your cholesterol. Testosterone work on many different aspects of our well-being. The difference between one young man and old man is a hormone. The one is the higher hormone, the other one has a lower hormone. This 13 component, which is I explained to you guys, is very important. Pay attention to it, talk to your physician, and hopefully you don't have none of those. But again, if you like my program, if you enjoy it, please subscribe, ring the bell, give the thumbs up, and also you can go to drsokhandan.com and write your issue, your question, and I will try to answer that on next show, which is I have on YouTube. Wish you have a nice day. Good day.